Hello, folks. Welcome to another episode of Inside the Marble Palace. I'm Murray Mandryk, political columnist for the Regina Leader Post. Joining me this week with a new look, Arthur White-Crummey of the Leader Post, our legislative reporter, and Zak Vescera. How did I do that? Wait, yes, better. I'm getting better every week.
Pretty good.
Of the
Pretty good.
Star Phoenix, smart young fella who's going to talk to us immediately about what's going on in the latest developments on the COVID front. On that matter, we seem to be seeing a premier maybe taking a step back in terms of some of his speculation on reopening, but certainly selling hard the notion that vaccines are the way out. What was said yesterday, and what particularly caught your attention that you think the public should be watching over the next week or so, Zak?
I think one of the most striking things for me in yesterday's press conference was the discussion around the capacity in our intensive care units. We have a record number of people with COVID-19 in ICU in Saskatchewan right now, the bulk of them being in Regina. We've heard so much about the Queen City's ICUs, how they're on bypass, how they're being forced to double bunk people at this point because there just isn't enough physical space. And just most importantly, perhaps, how deeply exhausted the staff are on every front. And we heard some clear warnings about that yesterday. We had SHA CEO Scott Livingston say that if what happens in Regina happens in our other critical care centers, we're in big trouble. And we also heard Dr. Zak Vescera, the chief medical health officer, talk about how workplaces are really driving this transmission, how we're seeing outbreaks in kind of those settings where we've heard so much about the virus spreading. But what was kind of missing for me, Murray, is there wasn't really any direct measure taken to prevent that transmission. Dr. Shahab talked about how the existing measures aren't going to be enough to stop the variants, but there was nothing really introduced to do that. Our existing restrictions have kind of just been extended.
Yep.
And once again, we're really looking to vaccines to lead us out of this thing, at least according to Premier Scott Moe. There was good news on that front. The federal government has purchased 8 million more Pfizer doses, half of them arriving in May, which means we're going to see our Pfizer deliveries in May double. That means we're looking at more than 500,000 Pfizer doses arriving in this province before July alone, on top of some Johnson & Johnson, AstraZeneca, and hopefully more Moderna, although that's been slashed. So while the midterm vaccine front looks very, very, very good, the situation in our ICUs and on our critical care teams is very, very bad.
I'll get to you in a second, Arthur, but it drives me nuts because you touched on two things that frustrate the hell out of me at these press conferences and the public in general. One of which is the inability for this government, up to and including Dr. Shahab, to provide a direct answer. Because I think I asked him pretty directly, what advice did you give the premier? I'm not expecting them to disclose private conversations or stuff that they can't disclose, but generally speaking, we have ICU doctors in Regina saying we need help. We're in trouble. The very notion of another doctor agreeing with that, I think, is a powerful thing at this particular moment and should have been said. And that's certainly something that doesn't necessarily come out at these press conferences sometimes. That said, I think I heard a little bit more concession from the government, at least in terms of how quickly they're going forward with maybe the reopening plans. And maybe that's something else you just touch on very quickly in terms of what you thought you heard, Zak, and how that might sound a lot different than maybe what we heard from the premier last week, and I guess maybe change the date, because we're pushed back right now to basically mid-May. So there's certainly no hurry. We'll start about the same time as CFL season, apparently.
Right, yeah, and on the subject of the reopening, and Arthur has covered this more extensively than I have, but one thing I'll note from the press conference is that right at the very end, Anna McMillan of Global News asked the premier whether it was premature to be musing about a reopening in post-vaccine world, given the state that we're in right now in Saskatchewan. And Premier Scott Moe's response to Anna was to basically say, I think it's premature to talk about us talking prematurely about this. And then he went on to talk about it more. So it was sort of a confusing mixed message where the premier is kind of, last week was really trying to project, like, here's what the post-vaccine future will look like. We're looking forward to that. We have this very ambitious goal he stated of at least expanding eligibility to everyone 18 and up by mid-May. Ideally, everyone gets their first shot by end of June. So not that far away, but he seemed to I agree with you, Murray. He seemed to walk that back a little bit, didn't want to engage on that front as much. Perhaps I have some recognition that that it was just not the tone that many people were looking for.
One big problem that they're having, Arthur, right now is they aren't getting enough help from the federal government, particularly in relation to vaccines and the distribution thereof, and maybe other issues as addressed in the budget. Now, in fairness to the federal government, I guess, they can only do so much when they don't have a supply. We don't have capacity in this province to produce our own vaccines. We've talked extensively about that both in the newspaper stories and on this particular podcast. But on those two fronts, in terms of the federal government helping them this week, both with vaccines and the budget, was the federal government somewhat helpful or more helpful than maybe Scott Moe will normally acknowledge? Interestingly, he acknowledged that one thing positive about Justin Trudeau that caught everyone's attention, including Scott Moe, is that certainly AstraZeneca is one way out. We're lowering the age of that. But in terms of the specifics related to Ottawa, the federal budget and vaccines, what was happening on that front this week, and what do you think the public should be paying attention to that will affect them in the not too distant future?
Well, we've heard very much the same sort of reaction to federal support on vaccines from the Premier that we've been hearing whenever he's faced with bad news, and that's that we want to move faster, but the federal government's vaccine allocations and the slowness of that process is preventing us from doing so. He said we're only getting 30,000 vaccines a week at this point. We've essentially run out of those within days. We have the capacity to do much, much more. The province, I mean, as far as he seems to be arguing, would essentially be out of this if Ottawa was able to get its act together. So that is one stream of messaging, but we also got the federal budget on Monday, and I found that the Premier was relatively positive and welcoming, perhaps more so than I've heard him in for any recent federal budget. I mean, we haven't had a federal budget in 2 years, so it's kind of hard to remember what it was like before. But he found a lot to like. He talked about $3 billion for long-term care, more contributions for VIDO up in Saskatoon. I'm sure, and I know Zak has been covering that very closely. That's something that VIDO itself was welcoming. The Premier was welcoming it. Obviously, if that goes forward, we might be better prepared for the next pandemic whenever that comes. And then the third was support for CCS. Carbon capture and storage, which has obviously been a favorite of the Sask party government in the past, but has really been in abeyance recently with no movement on Boundary Dam or Shand. I know Estevan has been very concerned about that. And now we're hearing that the federal government is implementing what we're expecting to be a pretty generous tax incentive for that technology, and also further research dollars. So these are all goodies that the Saskatchewan Party is pretty excited about, but you didn't really hear them comment very much about the flagship item of the federal budget, which is the $30 billion investment in childcare, which is really huge and was really the lead in pretty much every national story, apart from the deficit, which we can get around to later. Premier Scott Moe didn't even speak to that unprompted when he came out to muse about the budget. And really, we had to ask him and his finance minister for reaction, and they expressed concern that because the province might be required to match those dollars, it's going to draw money away from other priorities, which is pretty surprising. And the NDP was all over that yesterday, and I think you can maybe expect to hear them go after it again.
I really don't know what there is not to like in this federal budget if you are Scott Moe. Obviously, you cannot like deficits. You cannot like debt. But apparently Scott Moe does, if I look at his last budget provincially, because we're hitting record debt and record deficits. I guess you can pretend not to like the notion of paying half your childcare costs in this province, but I'm sure you guys, if I said, hey, can I pay for half your grocery bill this week? You might say, gee, thanks. That's a good idea. That's not exactly what we heard from Dustin Duncan, Education Minister, this week. Arthur, what do you think problem is there? Is this politics? Is this the reluctance of this particular conservative-minded Sask Party government to say anything positive about a federal Liberal government? Or is it just a legitimate dispute over priorities, as I think Finance Minister Donna Harpower outlined, and not wanting to commit to both? Can you sort that out for the public right now as best you can?
To be fair, I mean, I don't think that there's a considerable likelihood that the province is just going to refuse $1 billion in.
I don't think that's going to happen either.
In childcare funding, if that is what our per capita allocation gets us. But I think what they're traditionally most concerned about in these cost sharing programs is conditionality. We heard Dustin Duncan repeatedly speak about flexibility, the need for the province to decide itself where it's going to put that money in terms of its childcare program, saying that every province has its unique circumstances. Also, he was acknowledging something that was also in the federal budget that had a graph showing affordability in different provinces, and suggesting that our affordability is actually one of the better in the country in terms of childcare. Alina Young came out afterwards for the NDP and was not particularly taken with that argument, as somebody that just had a young child, arguing that she was going to have to pay $1,000 a month in childcare here in Regina, and framing it as part of a job strategy to have an effective childcare program to help get women back into the workforce, which has obviously been her favorite topic and allowed her to go after her foil, Jeremy Harrison, again in the chamber, and I'm sure we'll see that again in the coming days.
They do a delightful tango, don't they?
But you also talked about deficits and what some might see as a double standard, with the province showing itself to be a little bit queasy about the size of the federal debt and deficit when Saskatchewan itself is running record deficits. That being said, I think this needs to be put in context that the federal debt is significantly higher than the provincial debt
on a per capita basis.
Yeah, and as a share of GDP, it's expected to get somewhere around 50% in the coming years, which is kind of scary. Interest payments are eating up hundreds of billions of dollars. It's really a different situation from what the province is facing, but everybody's in the same boat right now in terms of the revenue hole that governments across the country are stuck in. The federal government is just also deciding that now is the time to just shell out tens of billions of dollars to reboot the economy. And I know that a lot of economists are a little bit skeptical about that, given how much money is just sloshing around the economy, ready to trigger more inflation.
Well, obviously, debt and deficits are not the provincial government's strong point, but that's an excellent point that you made, Arthur, in terms of the notion that it's a different situation federally than it is provincially. One thing that federal governments do is provide overall funding in areas that the province sometimes can't. And obviously, VIDO Intervac is one of those particular areas. I'd like to talk to you about that funding, Zak, and overall vaccines. What's being given to VIDO Intervac right now will not help the immediate problem with COVID-19. However, it could help in the future. In the immediate, we have a vaccine issue, and one of the issues that is related to that in terms of the Moderna supply might have been addressed with greater Pfizer numbers coming in May and June. I believe something in the neighborhood of 60,000 a week in May and 70,000 in June. Can you talk about those two things? Start with VIDO Intervac and how that in the future might not get us in the next pandemic problem that we're in right now.
Sure thing, Maria, and I'll start maybe by telling you a story. The first time I ever visited the Vaccine and Infectious Disease Organization at the University of Saskatchewan was in January 2020, and I was there to do an interview about African swine fever, which kills a lot of pigs, it turns out. And while I was there and interviewing their CEO and president, Dr. Volker Gertz, another topic came up, which was that they were working on a vaccine for this new strange virus emerging from China. And guess which one of those stories was more important in the end?
The pigs. The pigs, definitely the pigs.
Yes,
Absolutely.
no, we must think of the hogs, of course. But VIDO Interback, yeah. I mean, it goes just by VIDO now. They recently changed up their name for the branding, but they have, been this kind of quiet powerhouse in Saskatchewan for a long time, especially when it comes to developing vaccines for livestock. And they jumped on this COVID-19 vaccine right when the virus emerged in China in December and started work on it in January, because they have a lot of expertise with those diseases that cross the human-animal barrier and start to circulate among humans. Those zoonotic diseases are really their specialty. And what they really found while they were working on the vaccine is that even though they got that really early start, pretty soon your Modernas and your Pfizers were handily outpacing them. Part of that has to do with how well resourced those companies are and the technology they used. But part of it, according to Dr. Volker Gertz, was the issue of sort of just having everything in a one-stop shop. VIDO had to go to other partners to test its vaccines in some cases. It had to import certain materials from other partners. It had to have all these moving parts outside its facility in Saskatoon that made the whole thing more difficult and complicated. And historically, that's partially because we don't have great vaccine manufacturing capacity in this country. It's something that Justin Trudeau and the federal Liberals have been lampooned for by the Conservatives. And it's part of the reason why we have a slower rollout in this country, Murray. So what VIDO has done is kind of really strategically capitalized on this moment. They already had federal and provincial dollars to build a vaccine manufacturing facility on site right here in Saskatoon. They've gotten money to test out their vaccine candidates, which are about to move into phase 2 trials. And now they've secured just north of $59 million over the next 3 years from the federal government to create what they're billing as Canada's next pandemic center, basically creating a giant research, manufacturing, and development hub for vaccines, ready to get to work on the next pandemic whenever it comes out. And it's really perfect timing to do that. And that federal funding was incredibly crucial because while the province had pledged $15 million in capital costs, and the city of Saskatoon said, "Hey, we'll even chip in to get our name on the thing and throw in $250,000," both of those were contingent on that federal funding coming through. So that has now happened, which is good news for the city of Saskatoon, I would say. Go ahead.
Okay.
That all sounds very interesting, Zach, but what we really want to know is what happened to the pigs. Are they healthy? Did they get their vaccines? Do they have the flu?
Unfortunately, African swine fever continues to be one of the most deadly diseases circulating among hogs. It actually killed about a third of all pigs in China, which is a crazy thought when you think about it. And they will continue, by the way, to be working on those vaccines for livestock because obviously that's a huge industry here in Saskatchewan. So we are still thinking about the pigs, Arthur. Thank you very much.
There is no denying the importance of pigs. And if you get to know them, you'll kind of quite like them. I grew up with pigs. The topic at hand, guys. Let's get back on track a little bit and wrap this up, I guess, because we're running a little bit out of time. Vaccines. Before you leave, Zach, and we finish up with Arthur, can you tell us where we are at with the vaccines and why the Premier seems to be so determined to see vaccines as a solution and whether that's realistic right now? Good news in terms of Pfizer, bad news related to Moderna.
Sure. So the good news on Pfizer is obviously pretty significant. They're doubling their expected deliveries over the course of the month of May and then going even further in June. So what that means in terms of numbers is north of 60,000 doses a week in May that are scheduled, and I think north of 74,000 doses a week in June. And that's a lot of vaccine coming in a short period of time. That's partially going to be offset by the fact that Moderna has slashed its remaining April deliveries in half and is also delaying some deliveries that were supposed to come in the second quarter. That vaccine is very important when it comes to getting to rural and remote areas in this province, Murray, but the Pfizer deliveries more than make up for that. And we were also told by Federal Procurement Minister Anita Anand that we are expecting to get our first shipment of Johnson & Johnson by the end of the month too. That should be coming to provinces by May, and some more AstraZeneca on the way too. So the vaccine stream really is slowly becoming a flood. And this is really, really good news for the province's delivery plan in terms of getting a vaccine into every arm by the end of June. Minister Paul Merriman, the health minister, has insisted the capacity is there. We have yet to go full throttle on this vaccine plan. We don't know what full throttle looks like. We'll have to wait and see. But I think there is a reason why the province is really hitting that note over and over again, and it's because we do have a pretty good track record so far of getting these vaccines out fast. And if we have the supply, we might just be able to go to the next level here.
Arthur, I'm going to end up with you and tell me about the politics of vaccine as you're seeing it. It seems that it's being trotted out consistently by the premier because it's the one thing I think everyone can agree on in the province. There is vaccine resistance, but even yesterday he talked about how there's less of a problem with that than maybe even in the States, where there's been significant resistance. Even North Dakota they talked about, which is slowing them down a bit. What is it that will work here? Is this the way out, or is it partly of the way out and a combination of a political strategy, that this is just something that we can all agree on, and that compliant people in Saskatchewan will eagerly take up, because that's just the way we are?
Well, I mean, it's not surprising that the government wants to talk about the one COVID sort of metric where they can honestly say that they're the best in the country. It's the only one, and it's an important one. But as we've heard again and again, it's not going to prevent our health system from facing significant kind of pressures in the short term on its own. That being said, it has turned out to be a somewhat politically contentious issue, even amid the province's relative or quite good vaccine rollout numbers, because there's been a lot of dispute about which essential workers and which priority groups should be vaccinated when. And we did see some fairly prompt movement from the provincial government in response to criticism from teachers and police officers and firefighters. They're going to be prioritized as soon as we get under 40, which was sort of the keynote of the press conference yesterday. So we've seen a government that wants to talk about vaccines and has been fairly responsive in terms of the criticism that they face from essential workers, though after a long period spent defending their age-based vaccination framework.
There's obviously so much we could talk about in this and could keep on going, but unfortunately this is all the time we have for the day. Zak, Arthur, thank you for this. This was fun. We talked way more about pigs than I initially anticipated. Thank you for that, Zak. Pigs is great. And thank you, Arthur. Looking good, man. Looking sharp.
Yeah. Well, I'm just waiting for our next podcast that's in development, Pig Talk, which is obviously
I'm there 24/7. I'm here for the hogs all the time. You guys know that.
Indeed. Thanks, guys. We'll catch you next time.